I'm Dr. Philip Meredith, and I'm a child psychiatrist and the medical director for CHAMP, which stands for Child Access to Mental Health and Psychiatry. And we're a team of mental health professionals that answers questions from primary care providers about the mental health issues in their patients.
I'm Gigi Holder, a licensed master social worker and the program director for CHAMP. I'd like to tell you how CHAMP works. A provider calls the CHAMP consultation line, completes an intake for a child that's in their care, and it's usually with me. If the patient needs a medication consultation, I'll forward the provider to Dr. Meredith, our pediatric psychiatrist. If the patient needs a behavioral consultation or the provider wants to discuss mental health resources, then I will forward the call to one of our clinical psychologists, Dr. Sarver or Dr. Ford. If the patient's family needs resources for dealing with schools or systems, I will forward the provider or family to Dr. Joy Hogue at Families as Allies.
Providers can call us for a number of different reasons. Sometimes families will come and express concerns about development, or a child might be having behavioral concerns, or they might be worried about anxiety or depression or autism.
We get a lot of calls about issues about ADHD or medication management about ADHD or depression. We get a fair number of calls about autism or resources and referrals of where can I send my patient for behavioral therapy for a given condition.
The title is medical director, but what that means is I'm the prescriber for the team. I am the one that has the knowledge base of psychiatric medication that can help the patients that are in the office of the primary care provider. So what typically happens is a primary care provider, such as a family medicine doctor or a pediatrician or a nurse practitioner, calls the CHAMP line, and within a few minutes is able to get me on the phone if there's a medication issue involved, and I have a discussion in real time with that primary care provider, many times while the patient is actually right there in the office, and we discuss the issues that the primary care provider sees as being the most problematic that might be amenable to medication treatment.
Really anything that has to do with kind of emotional or behavioral well-being are areas that we can be of help and support.
We maintain a list across the state of resources and referrals so that we can provide providers that information so they don't have to go out and take the time to look that information up. We have it ready on our fingertips to provide those providers.
When we were forming the CHAMP team 2 years ago, Dr. Sarver identified Families as Allies as one of the key players in our developing a statewide network of primary care providers and families that would be invested stakeholders in the success of CHAMP.
We are a statewide organization run by and for families of children who have behavioral health challenges. So we can provide support to CHAMP families who are going through different things with different systems. And we can also provide support to CHAMP providers who are trying to figure out how to best help families with different system navigation issues. But one thing that we think is really important with CHAMP is to be able to work at the policy level to make sure programs like this exist and are sustained in the state.
Families have trust with their primary care physicians for their kids, and so CHAMP helps fill this gap of not having access or to child psychiatry services and information by us taking that knowledge, providing it to the provider, and then that provider giving it to the families.
One thing that's come out of COVID is that we've seen a huge increase in telehealth, and we've seen how helpful and how effective it can be. And I think CHAMP is fortunate that we had already kind of gotten started with that, and this has only sort of, I think, helped our providers to feel more comfortable calling us and using this type of venue to access care.
The purpose of CHAMP is to help primary care providers throughout the state of Mississippi get pediatric mental health care for their patients as quickly and easily as possible. We encourage you to take advantage of this program at no cost to you or your practice. So give us a call. Call CHAMP at 601-984-2080. We look forward to hearing from you during your next pediatric mental health consultation.